Sir, kindly describe something about Cushing's syndrome.
Cushing's syndrome. Okay, just let me tell you one thing first. Cushing's is actually a situation in which the cortisol levels are increased. Okay. Now, when we talk about Cushing's, Cushing's is of two types. One is ACTH dependent, one is ACTH independent. In ACTH dependent, cortisol level by the adrenal cortex is raised due to ACTH, due to stimulation from ACTH. And the one which is non-ACTH dependent, it is in that scenario, the ACTH levels of the body from the pituitary will be declined. Okay. Now we come to the ACTH dependent cases. Number one, there is a tumor of the pituitary, most commonly a pituitary adenoma, which is secreting ACTH. It will cause an increase in the cortisol levels from the adrenal cortex. It will be known as Cushing's disease. This is the first type of ACTH dependent scenario. And when you go about the second one, it is due to an ACTH secretion from an ectopic source, which can be most commonly a small cell carcinoma of the lung. It's a tumor of the lung, which secretes ACTH ectopically, which will cause an increase in the cortisol from the adrenal cortex. However, when you come to the other type, which is ACTH independent, it is due to a tumor of the adrenal gland, can be an adenoma, can be a carcinoma, and yet again, a very famous situation in those parts of the world where steroids are abused. The steroid can be given orally or injectably, and it would be in a higher dose, which will be resulting in Cushing's syndrome. So, just a point to summarize all of the aspects. Cushing's disease is ACTH dependent Cushing's, which is due to increased ACTH being secreted from the pituitary. Remaining all are syndromes. And one more thing, clinically different in ACTH dependent Cushing's disease, which is of the pituitary, the patient will be hyperpigmented because when ACTH is produced, MSH is also produced, which causes hyperpigmentation. MSH is melanin stimulating hormone. While in all of the other cases, the pituitary ACTH will be depressed and MSH will be depressed, the patient will be hypopigmented. That's all.